You know, in the high-stakes world of neonatal intensive care, some of the absolute biggest battles are fought in the tiniest of patients. Today, we're going to dive into a really powerful medication called Milrinone. It's a specialized tool that can literally turn the tide in the most critical hours of a newborn's life.
Okay, so think about it. The second a baby is born, their body has to pull off a whole series of miracles, right? Instantly switching from getting oxygen through the umbilical cord to breathing air. But sometimes that switch falters. And when it does, that tiny heart and those brand new lungs face this overwhelming challenge, a fight for every single molecule of oxygen.
So the condition we're zeroing in on today is called persistent pulmonary hypertension of the newborn, or PPHN for short. And in the simplest terms, it's just dangerously high blood pressure, but specifically in the arteries of the lungs. This pressure creates a physical barrier, making it incredibly difficult for oxygen to get into the bloodstream and out of the rest of the body.
So what's really going on inside a newborn's body during this critical fight? To understand how the treatment works, we first have to get a really good handle on the problem itself. Okay, picture the blood vessels in the lungs like tiny, tiny highways. In a healthy newborn, these highways relax and open up wide, letting all the blood cells cruise through to pick up oxygen. But in PPHN, those highways stay constricted, completely squeezed shut. It creates this massive traffic jam, a dangerous roadblock that stops life-giving oxygen in its tracks. So, how in the world do doctors clear a roadblock that critical? Well, this is where our main subject comes in, a specialized medication designed for exactly this situation. Let's talk about Milrinone.
This quote just nails it, right? It perfectly captures Milrinone's two-part mission. First, it directly attacks that roadblock by reducing resistance, which just means it helps open up those squeezed blood vessels in the lungs. And second, it enhances myocardial contractility. That's just a fancy way of saying it makes the heart muscle pump stronger. It's a real 1-2 punch, tackling the problem from both sides.
But hold on, how can one little drug do both of those things? To figure that out, we've got to zoom in. I mean, way in to see the elegant little cellular switch that Milrinone flips. All right, here we are, down at the microscopic level. This is a look inside the wall of a tiny blood vessel in the lungs. And the key players here are these smooth muscle cells. When they contract, they squeeze the vessel shut. And that's the whole problem. Milrinone's entire job is to get in there and tell them to just relax. And this pathway shows us exactly how it gets it done. So Milrinone enters the muscle cell, and its first move is to block a specific enzyme called PDE3. By blocking PDE3, it allows another molecule, a messenger called CAMP, to build up. And this buildup of CAMP, that's the crucial signal that tells the muscle cell, hey, let go. When millions of these cells relax all at once, the blood vessel pops open, and just like that, the roadblock is cleared. So we've seen that tiny little switch get flipped at the cellular level. Now let's pull the camera back out and see how this one simple action translates into easing the massive, massive burden on that newborn's heart. To really get what the heart is up against, it helps to know two key terms, afterload and preload. Afterload is the resistance the heart has to push against. With PPHN, that resistance is enormous. It's like trying to open a door against a hurricane. Preload, on the other hand, is the amount the heart muscle stretches before it pumps, kind of like pulling a rubber band back before you let it fly. And boom, this is where it all clicks. That cellular relaxation we just saw, that leads to pulmonary vasodilation, the opening of the lungs' blood vessels. This dramatically cuts down the afterload, so that hurricane basically dies down to a gentle breeze. At the very same time, Milrinone has that second effect, positive inotropy, which means it directly makes the heart muscle contract more forcefully. So it doesn't just clear the path, it also gives the pump a much-needed power boost. And this graph? It just says it all, doesn't it? On the left, you see that dangerously high resistance before the treatment. Then, after Milrinone gets to work, look at that drop. That resistance plummets. This single change is what allows blood to finally flow freely through the lungs, grab oxygen, and stabilize the baby's entire system. It's incredible. And here's the part that is just so clever about Milrinone. A lot of other heart medications are like keys that have to fit into specific locks, or receptors, on the outside of a cell. Well, in critically ill babies, those locks can sometimes get worn out or just stop responding. But Milrinone is different. It's like a master key that bypasses the lock on the door and goes to work on the machinery inside the cell. That means it can still be effective even when other drugs are failing. Okay, so we know how it works. But now, let's get real for a second and look at the bigger picture. In the real world of the NICU, using a powerful drug like this is always a balance between incredible benefits and some serious potential risks. The benefits are crystal clear. The baby gets more oxygen, blood flow improves everywhere, and that overworked heart finally gets a break. But because milrinone is so good at relaxing blood vessels, it comes with one major risk that doctors have to manage very, very carefully: the potential for a drop in overall blood pressure, which is a condition called hypotension. And this is the #1 thing to watch for. It's absolutely critical. That same cellular switch that works wonders in the lungs, well, it doesn't just work in the lungs. It works on blood vessels all over the entire body. This widespread relaxation is what can cause that drop in overall blood pressure, and it's exactly why monitoring has to be so constant.
So, really, it's a fascinating paradox, isn't it? The drug's greatest strength is also the source of its main risk. It's this powerful tool that works system-wide to ease the burden on the heart, but maintaining that perfect therapeutic balance, well, that's the art and science of neonatal critical care.
And this leaves us with this incredible challenge for the future. Milrinone is an amazing tool, but its system-wide effect really highlights a bigger question. How can we design even smarter drugs? Drugs that are so precise they can relax the blood vessels in the lungs and absolutely nowhere else, offering all of the benefits with none of the risks for medicine's most fragile patients. Something to think about.